With this video, we're going to talk about the way that you want to hinge or move from your hips instead of your lower back when it comes to lifting, picking things up, specifically the movement of a deadlift. So we talked about the awareness of your pelvis, and that's kind of the first cue for this, is that if I tip forward and backward, I want to be a little bit more on the tip backward, butt underneath me part of this, right? So what I want to do here is I want to keep my back pretty much where it is as I try and go down towards the floor. So I'm going to do that through my hip joint. So if you watch me from the side, I want to try and keep this area locked into place. I start off by having people try and take their butt and their head in opposite directions. So there's no movement in my back, everything is coming from my hips. And to stop me from falling over, I have to have an equal movement of my butt and my head in opposite directions to keep my weight centered over my feet. So I bend my knees slightly, and I try and take my butt back as my head goes forward. Many people are scared to do this because they feel like they're bending at their back. This is bending at my back, right? It's okay to let my head go forward as long as it comes from my hip joint. So small bend in the knees, I'm trying to keep this locked into place as I come down. Now ideally, as I do this, I shouldn't feel any pain or pressure in my back. I should feel a little bit of tension in my hamstrings, right? And if I want to get down to the floor, after I've created this hinge, I'm then going to drop down into my heels to reach down towards the floor. Okay? And then once again, maintaining this neutral position of my back as my butt comes forward underneath me. So that's what we talk about in regards to a hip hinge. You're going to see some different drills to ensure that that happens. But that's the mechanics of it. Sometimes I even have people create a little bit of tension in their stomach to stop them from falling into this lordosis or excessive curve of the spine.